Welcome to First Aid Training presented by Health Solutions of Idaho. All information is obtained through the American Heart Association and the American Safety and Health Institute. Follow along with the video and answer all questions on your test. Pay attention to the titles at the top of the screen. They will help you answer the questions on your test. All questions are in order with the video. Once completed, you will hand your test in. Once you think you have read or heard the answer for your test, pause the video, answer it, and then move on. Once you are completed with your test, you can hand that test in by fax, email, or mailing it to the address below. Remember, all we need is the answers. Doesn't have to be the test. So, let's begin your first aid. Here's the course outline for the remainder of the video. Good luck. Importance of first aid. If you find the victim is a DNR person, all you can do is call 911. The Good Samaritan Law. Remember, it protects you from getting sued. And when it comes to your skill level, if you don't know it, don't do it. When it comes to first aid, always get consent. Remember, your first thing to do on a first aid victim is assess the scene. If it's not safe, don't go into it. Always protect yourself first and just call 911. If you're ever going to touch the victim, make sure you put on your PPE. Always protect yourself from bloodborne pathogens. It's always a great idea to keep CPR masks and gloves in your car at all times in case of emergency. When dealing with children, it's very important to remain calm. They play off your emotions. Even though you might be scared on the inside, you have to remain calm on the outside. And always assess them the farthest away from their face so you don't put them into a panic. Remember, first aid kits are for basic first aid. They're not for advanced care. DOTS is a way of identifying the first 4 major injuries you should look for in dealing with a first aid victim. In dealing with deformities, remember, don't ever straighten it out, don't try to correct it to its normal position. Leave it in the position you find it in and cover it so that person doesn't look at it and other people won't see it as well, putting them into a panic or shock. The best method for bleeding control is direct pressure. Don't ever remove the first bandage until the bleeding is completely stopped. If it continues to bleed, just layer the dressings on top of each other. Other methods of bleeding control. Tourniquet should be your last resort. When it comes to icing injury, make sure you place a towel in between the skin and the bag of ice to avoid damaging the skin. Maximum amount of time of icing an injury should be 20 minutes.
Sample is a series of questions we like to ask victims to gain crucial information in case they go unresponsive before EMS arrives. It is important to lay someone on their side and into the recovery position if they do begin to vomit. Make sure their head is supported by their own arm and that they don't choke or swallow the vomit. If they do, that can cause severe brain damage.
Okay, now let's get into some specific injuries. Shock develops when there's not enough blood flow to the cells of the body. The body is beginning to shut itself down. Signs and symptoms of shock. When treating for shock, remember, keep the person warm, keep them thinking, don't let them go to sleep. Keep their mind working. Amputations. Impaled objects. Do not remove the object unless it's blocking the victim's airway. Open chest wounds. When dealing with minor wounds, like cuts and scrapes, a first aid kit will work just fine. Remember to clean the injury and change the dressing every day. Burns. The most common first-degree burn is a sunburn. Don't ever use ice on a burn. It can damage the skin that is burned. Don't apply any butters, creams, or lotions to cool the burn down. All you'll do is trap the heat in, and you can turn that first-degree burn into a second degree. Once the burn is cool to the touch, there is one lotion we do recommend, and that is aloe vera. Second-degree burns. Whether there's blisters or the blisters have popped. Again, remember, don't use ice. You can damage the area that is burned. Once the burn is cooled, just remember to cover the injury with a clean dressing to prevent infection. All third-degree burns are a medical emergency. And remember, if you're on fire, just stop, drop, and roll. And if you have a chemical burn, remember to flush the area with tons of water. And seek medical attention. Electrical burns. The most common sting is a bee sting. Never use your fingertips or tweezers to remove the stinger. You'll just squeeze more poison into yourself. Always use your fingernail, credit cards, or a piece of paper to flick and scrape the stinger out of you. There's only one poisonous snake in Idaho, and that's the rattler snake. Remember, don't bleed the bite, don't try to suck the venom out, remain calm, and seek medical attention immediately. You can put a cold compress on the bite and tie a snug bandage above it to help slow the venom spread through your body. And remember, remain calm. Finish this slide. When you're done reading it, pause this video, go down to the videos below and watch the video on tick removal. Black widow bites. Remember, the black widow likes to live in dark places, away from you, in your crawl spaces, the shed, the garage. Remember, when you get bit, it's not the bite we're concerned about. It's when you get sick. It'll be like the flu. Your body will ache, it will stiffen, you'll get a fever, you'll be nauseated. This will require you to seek medical attention. The hobo spider, the aggressive house spider. Look for the two front legs to have furry little balls on them. Remember, when you get bit, you won't get sick, but it's the bite that we're concerned about. It might start out to itch, but eventually it will turn into a blister. It will eat away at the tissue that you have. Here are a couple examples of some hobo bites. The first one was after a couple of days. The other one's after day 10. Remember, when you get bit and it does begin to blister, you need to seek medical attention. If you know you've been bitten by a black widow or a hobo spider, seek immediate medical attention. If you have a bite or a sting that involves a poisonous snake, spider, or insect or animal, make sure within 30 minutes you do place a light tourniquet, at least 3 to 4 inches above the bite. This will help slow the venom spread through your body. If a tooth gets knocked out, the best way to save it is put it in whole milk or save a tooth solution. Eye injuries. If the eye ever gets irritated, something in it, don't ever rub the eye because you can damage it. Always flush it with lots of water. And ever dealing with major injuries with an eye, make sure you cover both eyes. By covering both, you will limit the movement of the injured eye because eyes mimic and move together. Nosebleeds are pretty common. Remember, don't ever tilt the head backwards. Always pinch, lean forward so that the victim doesn't swallow the blood or choke on it. If you do ingest blood, you will vomit it back up. The average time for a nosebleed is about 3 to 4 minutes. We talked earlier about deformities. Now we can talk about sprains, strains, and dislocations. When you're done reading this slide, pause the video, go down to the videos below and watch the video on splinting. Head, neck, and spinal injuries. Always assume that the victim might have a head, neck, and spinal injury. And if you think they do have a head, neck, and spinal injury, do not move them. There are only 2 reasons in which we do move someone with a head, neck, and spinal injury. That is if A, they're in a dangerous environment, and B, if we can't perform CPR and they're in need of it. Here are some basic signs of someone that might have a head, neck, and spinal injury. They could be unconscious, they can be confused, sleepy, their pupils could be dilated, neck pain, vomiting, might even have a headache. Remember, always assume that someone might have a head, neck, and spinal injury. Remember, with all the victims that we've been dealing with today and the injuries, if any of the injuries do compromise the circulation, the airway, or the breathing of the victim, that person needs to get advanced care immediately. Now let's talk about immediate medical emergencies. Here's some basic general rules when treating with anyone with a medical emergency. Here are some basic signs of medical emergency. If anyone has difficulty breathing, high fever, they're weak or ill, altered mental status, if you notice any of these signs, they need to seek medical care. And here are some of the reasons why they're having those symptoms. It could be a seizure, they could be having a stroke, a heart attack, asthma attack, diabetes, heat stroke, or hypothermia. All these are medical emergencies. Allergic reactions. People can have allergic reactions from medications, food, insect bites, stings, environmental allergies, kind of like plants, latex. Here are some symptoms if someone's having an allergic reaction. Some people with allergic reactions are anaphylactic, meaning the allergic reaction will involve the whole entire body. You need to pay attention to this person's airway and breathing. Know that their airway and breathing can completely shut off. One great medication for allergic reactions is Benadryl. Make sure you put Benadryl in a first aid kit or take it with you when you go camping. Some people that have allergic reactions or highly allergic to things carry EpiPens. Finish reading this slide. When you're done, pause this video, go down to the videos below, and watch the video on EpiPen use. Common poisons. Some great poison prevention ideas are as if you have children around the house, they're attracted to pretty things. So if the bottle has glitter or bright colors on it, they're attracted more to that. You need to take these items, keep them out of reach, or lock them up. Remember, don't ever induce vomiting, only unless directed by to do so by 911. Here's also some poison control centers for the state of Idaho and the United States. Keep these around by your phone in case of emergency. Two types of heat illness: heat exhaustion and heat stroke. Remember, if you don't get help from heat exhaustion, you'll get heat stroke. When treating for heat exhaustion or heat stroke, remember you need to cool the person down. We don't say cold the person down, which means you can't use ice, ice water, ice baths. If you cool them down too fast, you'll send the person into shock. One of our major concerns with a cold illness is hypothermia. Hypothermia is exactly just like heat exhaustion or heat stroke, just opposite. The person is now too cold. So remember, when it comes to the treatment of hypothermia, you need to warm the person up. We didn't say hot the person up, which means you can't use hot things. If you warm them up too fast, again, you will send that person into shock. Seizures. Seizures can come from many things. Remember, if someone's having a seizure and you don't know them, you call 911. That's a medical emergency. Don't restrain the person. Don't put anything in their mouth. Just let the seizure ride out until they're finished. And if you do know the person that's having a seizure and they has them regularly, make sure when they start the seizure, you time it. And if it ever reaches 5 minutes, you need to now call for medical attention. Heart attacks. So when someone has a blockage in the heart or the arteries around it, the three major symptoms are chest discomfort, pain in the upper body, and shortness of breath. And if you think someone's experienced a heart attack, you could also have them chew 1 adult aspirin or 2 child aspirins to help thin the blood. A stroke. Remember, this time the clot is in the brain. The best way to tell someone's having a stroke is to use this acronym called FAST: face, arm, speech, and time. Remember, if there's clot-busting drugs given to the person within the first 3 hours, all these symptoms can be reversed. The less damage is done. But the longer you wait, the more damage occurs. Here are some other signs of a stroke. Remember, if you ever doubt any injury, any situation, and you think for a second you should call 911, do it. If you're ever riding that fence, always play it on the safer side and call 911. If you do call 911, here's some information they're going to ask from you. Try to answer as best you can and as accurately, and remain calm. And remember, if you're by yourself and the victim needs CPR, don't stay on the phone. Leave it on speakerphone, because compressions need to be started within 10 seconds of calling 911 on the victim if they're needed. Well, that's it. You're completed with the first aid presentation. Remember, if you have any questions, call us at 249-7157, and if you're in an emergency, just call 911.